It's time for another new Kansas City Spotlight. Here's your host, Lauren Scott.
Heart disease is a term that refers to a number of conditions that affect your heart. Unfortunately, there are lifestyle changes that can help prevent or treat the illness. I'm Lauren Scott, your host for Kansas City Spotlight, and I sit down with Andrew Berkshire of North Kansas City Hospital to learn more. Today we're talking about heart health. What are 3 ways that we can actively work to improve our heart health?
Absolutely. It's never too early to start thinking about heart health. Number one, I always speak with my patients about get moving. It's always important to have an exercise regimen in mind. Number 2 is if you're a smoker, it's important to quit smoking. Setting a quit date is very important. Number 3 is be conscious about your diet. We want to be mindful about what we're putting into our bodies and their effects on our cardiovascular health.
Okay, so what are some other things that come to mind when you think about heart health?
An important part of heart health is knowing where you come from, your genetics, your family history. That can give us a good indication as to where you may be going in the future. Past exposures are important to know as well. And in general, how your overall health is.
Okay, so at what age should we begin to start thinking more about our heart health and, maybe going to a doctor to get checked on?
Well, that's a fantastic question because it's never too early to get started. With so much issue with the obesity epidemic, starting even in young children and early teens, I think it's important to have these conversations even in the elementary age. And then as you get older, obviously these things start to manifest. It's important to probably touch base with a primary care physician in your late 20s or early 30s. Start checking on blood pressure, cholesterol, things of that nature that can lead to cardiovascular disease in the future.
What are some indicators that someone might need to see a cardiologist?
Well, the first thing you obviously think of is the pressure in your chest. Worse with exertion, may get better with rest. Some people may not realize that worsening shortness of breath could be an indicator. Swelling in their legs can be an indicator. Racing heart, dizziness. These can all be subtle indications that you have some degree of underlying coronary or cardiovascular disease.
Okay, so do we need a referral to go see a cardiologist? How does that work?
Not necessarily. I think it's always a good start to check with your primary care physician because a lot of the same symptoms we just discussed could be a totally different condition. But if you feel that it's important to see a cardiologist, you can ask for a referral or you can seek us out directly.
All right, so if people want to learn more, how can they do that?
You can go to deservealeader.com.
This Kansas City Spotlight has been paid for by North Kansas City Hospital and Meritas Health. For more information, visit youdeservealeader.com.